Hi, Sally. So I've got a question for you. Did Bernie Sanders endorse the Affordable Care Act when it passed in 2009 or 2010?
Yes, he actually did, reluctantly, but it didn't remove him from supporting, legislation in 2017 and 2019, single-payer legislation into the Senate. So he reluctantly agreed to that. And of course, the Affordable Care Act will be 10 years old on March 23rd, which is just around the corner. But he did, but it's not what he wanted. But I think he saw it as a stepping stone in the same way that I think President Obama, who had been a supporter of single payer before the Affordable Care Act, then he said, well, the American people like their employer-sponsored coverage, so we don't want to go there. He really did want to go there, and he has said since he's been out of office that he supports single payer.
Well, I'll draw a parallel. So Bernie Sanders voted for the Affordable Care Act, which has deductibles as high as $8,000 for the minimum plan. And that's what's bankrupting families. Excuse me, bankrupting families. And Joe Biden voted for the Iraqi war. So you can't have your cake and eat it too. Do you agree, Sally?
Well, absolutely. And Joe Biden is pushing, not Medicare for all. He's pushing for the public option, which was in the original Affordable Care Act. A public option would be a government insurance plan to compete against private insurers. That's what he wants to build on Obamacare, that government option. Government would price their coverage lower, crowding out private insurers. And we would all then be left in Bernie's single-payer Medicare for all. It's just a slower approach to getting there. But he's not. He is for the same thing that Bernie is, just as I say, at a slower pace.
Sally Pipes, we have about a minute left. I was just at a conference, and someone asked me what I would do about health care. And I said, you don't want to hear what I would do about health care. And he said, what? I said, I would get the government out of it. The government pays 50% of our health care dollar. I would convert Social Security to private savings accounts. I would convert Medicare to health savings accounts. And I would get the federal government out of the business of welfare.
Well, absolutely. I mean, the federal government got us into this mess during World War II when wage and price controls were in. They allowed employers to write off the cost of their health care. Employers could attract new people, and people who have employer-sponsored coverage get it with pre-tax dollars. If you lose your job or quit your job, go into the market, you have to buy coverage with after-tax dollars. It's just fair. But the government got us into this mess, and 180 million Americans are in it.
Sally Pipes, thank you very much for taking the time, as always. We really do appreciate it.
Thank you, Sally.
Great to talk to both of you. Thanks.
Appreciate
Bye.
it.